everyone. Today I'm going to talk about some things to consider when doing Pilates during your second trimester of pregnancy. So I'll go over what changes are occurring in our body, what compensations to look for, and exercises that may need modifying. Everything that we're going to go over applies to other types of workouts too, but I'm just going to focus in on Pilates because throughout my pregnancy prenatal Pilates classes is what I'm going to be sharing with you all here on YouTube. I also have one of these videos that's focused on the first trimester. Most people don't need to modify too much during the first trimester, but that video is still nice. It kind of focuses on big picture, what to focus on when working out while pregnant. And then I'm also going to make one of these videos for the third trimester as well. Now, if you are new to my channel, welcome. My name is Nicole. I'm a STOTT trained Pilates instructor and a pregnancy and postpartum corrective exercise specialist. I am also very pregnant. I'm 38 weeks along while filming this, so I'm well out of the second trimester. But I digress. Let's jump into things. Every pregnancy is different, but the good news for most women is that the second trimester is when you're going to start feeling better. If you experienced nausea, headaches, exhaustion, all that fun stuff during the first trimester, hopefully now you're starting to feel a little better. I know for me, I was like taken out by hormonal headaches during the first trimester, and working out was not happening more often than it was happening for me. And then I hit the second trimester and I started to feel like myself again. I had more energy. I was in a better mood. I could eat food without wanting to barf it up. I've just felt so much better. So hopefully that is how you're feeling as well if you're entering your second trimester. Now, while we feel better, hopefully, the second trimester is when we will start to develop a significant bump, especially during the second half of that second trimester. So we will want to start modifying some exercises, and I think that's a good place to start this video, going into sort of which exercise you should think about modifying. First up, prone work, exercises done laying on your stomach. We do this a lot in Pilates to target the posterior chain. If you didn't already eliminate prone work later in your first trimester, you are probably going to want to eliminate it soon, early in the second trimester. Now, early on in pregnancy, laying on your stomach is perfectly safe for the baby. The baby is tiny, it's nestled deep in the cushioning of your uterus. It is fine, it's not going to hurt the baby. But as soon as you start to show, even if you're just showing a little bit, like that stage where it sort of just looks like bloating, it doesn't really look like a full-on baby bump, even then, I would eliminate prone work. If that occurs early in the first trimester, which can happen, especially if it's not your first pregnancy, it's still safe for the baby to lay on your stomach, but it's going to throw off the alignment of your pelvis when you come into prone work. So even if it's safe for the baby, the exercise isn't going to be effective. You're not going to be able to engage the core properly if you're showing, because it's going to throw off that pelvic alignment. Another thing to consider is your boobs. So as you get into this might happen early in the first trimester even, but boob growth and boob tenderness can make prone exercises really uncomfortable. So you might want to eliminate them even before you start showing if it's uncomfortable in the chest area. So the bottom line, if you didn't already eliminate prone work in the first trimester, I would eliminate it pretty soon into the second trimester. As soon as you start showing, even if it's still safe for the baby, it's going to throw off alignment. So nix it. Now let's talk about the opposite body position, supine work, or work done laying on your back. The concern with supine work is that as the baby grows, the weight of the baby can compress the inferior vena cava. The inferior vena cava is a vein that returns blood from the lower body back to the heart. As you can see in this bootleg diagram I got from Wikipedia, it's located kind of right next to the spine. If the weight of the baby is compressing the inferior vena cava, then it can lead to decreased fetal blood supply. Now, during the first trimester and the early second trimester, the baby just doesn't weigh enough for this to be a concern. You may choose to eliminate some flexion-based supine exercises like ab curls, for example, but that would be for a different reason. You would eliminate those exercises if managing the pressure in your abdominals that those exercises create becomes hard to manage. And I talked about this a little bit in the first trimester video. But as far as the suppression of the inferior vena cava, that's not something you would have to worry about. So exercises where you're not coming into flexion, where you're maintaining more of a neutral spine in a supine position, for example, bird dog exercises, those totally fine in the first and early second trimester. Now, as we get deeper into the second trimester, this is when the weight of the baby on the vena cava is going to become a consideration. So we would want to start limiting the time we spend on our back and eventually eliminating it. But for some women, it may be fine to continue doing supine exercises throughout the entirety of the second trimester. One thing to understand is that if the baby is suppressing the vena cava, you're going to feel like crap too, which is kind of a reassuring thing. You're not going to be harming your baby without knowing it. You're going to feel like crap too. So just notice how you feel in supine exercises. Any nausea or dizziness, or if breathing becomes labored, those are all signs that the vena cava is being compressed. And if you feel that way, you want to immediately roll onto your side, come out of the position, and then you'll know it is time to get rid of supine exercises for the duration of your pregnancy. Now, in all the prenatal Pilates classes that I share here on YouTube, I err on the side of caution. I don't want us to get to the point where we're having trouble breathing before we eliminate supine work. So that the classes can kind of be done for everyone, I just don't include supine work at all, even though it is perfectly safe for a lot of women to do throughout the second trimester. I just say err on the side of caution because there are so many other positions we can come into. It's not a huge loss to eliminate supine exercises. And if you're working out at home alone versus in the presence of a trainer, I would encourage you to err on the side of caution as well. Even if it's perfectly fine for most women to do supine exercises throughout the second trimester, it's not the case for everyone. So if you're working out home alone, why chance it? Last big exercise modification with Pilates during the second trimester is going to be front-loaded core exercises. So these would include plank-based exercises. It would also include exercises where you lean back. These exercises create a lot of pressure out on the front of our abdominals. And as our tissue gets stretched out, the abs just become less able to counter that pressure. So for a visual, I want you to picture blowing a bubble with chewing gum. As you blow that bubble bigger and bigger, what happens? The gum gets stretched thinner and thinner, and as it gets thinner, it gets weaker. Eventually, the pressure from the air in the bubble is going to be too much for that thin gum to contain, and the bubble is going to pop. Now, don't panic. You are not chewing gum. You're not going to pop. But the human equivalent of popping would be a severe diastasis recti, hernias, prolapse. So different, but same idea. As our abs and tissue get stretched thin, the further into pregnancy we go, they just become less able to manage large amounts of intra-abdominal pressure. So early in pregnancy, when our abs aren't stretched out, exercises like this probably fine, but we still do want to make sure we're managing pressure correctly using proper diaphragmatic breathing mechanics during Pilates classes. So engaging the pelvic floor and the deep core on your exhale as you go into the exercise can really help do just that. And I broke down that breathing technique in more detail in the first trimester video. So as your belly grows, when you are doing these kinds of front-loaded exercises, you want to monitor for coning. Coning is a visual sign that outward pressure is not being managed sufficiently by the abdominals. And it's important to note that it's not always visually obvious, especially in a pregnant belly, to see that ridge, that cone. So you also want to pay attention to how you feel in the exercise. So if you go into a leaning back exercise or a plank and you feel an outward push instead of an inward hug of your abdominals, then that is a sign you're not managing pressure well, and it's time to modify or eliminate the exercise. Because if you keep doing it with that outward pressure, it's going to lead to a more severe diastasis, which we want to avoid. There's not like one magical specific week when everyone should start modifying these types of exercises. I wish that would make things easier, right? But that is why it's so important to know what to look for and what to feel for so that you know when you should start modifying. So I would say for most women, it's going to happen at some point in the second trimester, but especially if this isn't your first pregnancy and maybe you didn't fully heal from your first pregnancy, you may find that you take these modifications much earlier in the first trimester. If you're an athlete, you may find that you don't need to start modifying these till the third trimester. It's just going to vary a lot pregnancy to pregnancy. So quickly, some good modifications for these exercises Instead of doing an exercise in that leaning back position, you would just keep the torso more upright, and that's going to make it easier to manage pressure. As far as plank-based exercises, you could drop to your knees, but even better than that, I like elevating your hands. So you'll notice in a lot of the prenatal Pilates classes that I share here, when we do push-up work, we do it with hands elevated on a bench or a coffee table and knees down, and we really focus on using our diaphragmatic breathing to support the core as we do it. You could also, if you need to modify further, even do it with your hands against a wall. So speaking of pressure management, let's talk a little bit about diastasis recti and prolapse. We'll start with diastasis. So diastasis recti is a thinning of the linea alba. The linea alba is the connective tissue that connects your rectus. Your rectus abdominis is your six-pack muscles, so the ones that run kind of right up the center here. Now, some separation and stretching is totally normal. It's going to happen to everyone. We got to make room for the baby, okay? So diastasis is not a word to panic over, but it's about how we load that separation, that stretching during pregnancy that is going to make the difference between some normal, minor separation and then a more severe diastasis recti, which is going to take longer and more effort to heal. So that's why we want to put such an emphasis on proper diaphragmatic breathing mechanics, on monitoring for coning or doming, and on modifying any exercises that are creating too much pressure. So we've established that pressure out front can lead to a severe diastasis recti. Well, pressure down on the pelvic floor can lead to prolapse. So we want to make sure that during exercises, we're not bearing down on the pelvic floor. You'll notice in my prenatal Pilates classes that when we talk about breath work, I talk a lot about emptying from the bottom up. And what I mean by that is thinking on your exhale, you think first, little lift and contract to the pelvic floor. Then the lower abdominals engage, hugging the bump up and in. Then you think about the ribs moving gently in and down. So you're sort of emptying this canister of air from the bottom up. Sometimes what happens is if we exhale and we lead with that contraction of the rib cage, we neglect the lower abs and it sends pressure down onto our pelvic floor, which we don't want. So if you think about initiating the exhale with that pelvic floor lift, that can help prevent that bearing down sensation. And this, by the way, is something great to implement whether or not you're pregnant. But as the baby grows and we have those pressure changes in our abdomen, especially later in the second trimester and third trimester, this is something especially we want to be mindful of. Okay, so let's finish up this discussion by talking about some form and posture compensations that we can start to see, especially in the later part of the second trimester as we get significant bump growth. The first thing we often start to see is a rounding forward of the shoulders and a forward neck position, which is caused by the increased weight of the boobs and the baby bump. So some things that can help with that are stretching the pec minor, opening up through the chest, and just continuing to work on strengthening through your back and your posterior chain. So those are things you're going to see implemented in a lot of my Pilates videos for this very reason. Going along with that rounding forward position can be an increased kyphosis, it's called, or basically just a rounding through your mid-back. Now, if our back is constantly in that hunched forward position, it can start to get pretty stiff. And this is not a good thing because with a healthy spine, you want the majority of your movement to come from your mid-spine. Now, if the mid-spine's all sticky, then we're going to compensate, and instead we're going to try to get that movement through the lower back or the neck. And over time, that can lead to a cranky lower back, stiff neck, cranky neck, pain up here. So throughout pregnancy, but especially as we get later in the second trimester, we want to try to stay as mobile through our thoracic spine as possible, and you will see that incorporated in my classes as well. Last thing to note about posture changes, as weight distribution changes and we get further into pregnancy, you may find yourself kind of hanging into locked joints. So you always want to be mindful of this, but especially as we get into the later second trimester, you want to be extra mindful of not locking out through the elbows, which I am guilty of a lot of times, and locking out through the knees during exercises. You also want to make sure you're not just hanging into your hip joints when you're standing around throughout the day. Another thing that plays into this is increased ligament laxity, which occurs in everyone during pregnancy. Because of this increased ligament laxity, pregnant women can be prone to hypermobility. So you also want to kind of take care when doing a lot of deep stretching. You may feel stiff and feel like stretching is what your body needs, but if you're hypermobile, what your body actually needs is support and strengthening around the joints. So that's not to say stretching is bad during pregnancy, but just make sure you are also incorporating strengthening to go with it. That's why I love mobility work and Pilates work as opposed to just holding a series of static stretches. So to sum it up, for many women, the second trimester is like the sweet spot of pregnancy. You're feeling good, you're energized, you feel like you could push yourself a bit in workouts. It is also the time, though, when most women start to get significant bump growth at some point during the second trimester. And with that growth comes stretched out abs. So this is when we really have to start monitoring for pressure management. Notice if there's any coning or doming and modifying accordingly. I know for me in the second trimester, I felt like my pre-pregnancy self, just with a little bump. And you'll see that reflected in the classes that I share with you all that I filmed during my second trimester. I take care and even eliminate a lot of front-loaded core exercises. I avoid certain positions, but in the body positions where it is still safe to challenge myself, I push myself, and I think you'll see that in the classes. They're prenatal, but they're not easy. They're really great workouts. But this is not meant to be a sales pitch about the classes. It is meant to be informative, so I will wrap it up. The next video that I share and the final one will focus in on some things to consider in the third trimester. So I will see you then.